Hello, I'm Eric from Delos Therapy, and I'm with Gina, CEO and co-founder of A Sweat Life. We're here to talk about knee pain today and what you can do to help remedy that if you are experiencing some knee pain. So Gina will be our model and our patient with knee pain. Knee pain can come in a variety of locations with a variety of causes. What we'll be talking about today is mostly the muscular causes of knee pain. So let's have you get down on the floor and let's assume that you have knee pain right at the top of the patella. Okay, that's probably one of the more common areas that we have knee pain. So if you understand the anatomy of the quadriceps muscles, all of the quadriceps converge and attach right around the knee. So as these muscles get tight, you can imagine it will pull right on the knee. So what we really need to do is stretch out all of these muscles. So the question remains, how do you stretch tight muscle tissue? The most common way people try to do it is by stretching the ends apart. So let's do a quadricep stretch, which is what most people try to do to stretch out their knees. So great. What that's doing, that's pulling apart everything that's pliable, that's capable of pulling apart anything that's tight, that feels hard, that's actually pulling on the knee and causing knee pain. None of that is actually moving. None of that is stretching. So
feels great.
It does feel great, and that's what's tricky is it feels really good and you'll do it, and what you'll be left with is knee pain. And this is something that I see clinically all the time where patients are saying, I'm stretching like crazy, feels really good while I stretch, but I still have pain and I still feel tight and I don't know why, because nothing that is tight is actually stretching. Does that make sense? So what we do is we actually force it to stretch. So if you think in 3 dimensions, just stretching the ends apart is just stretching in one plane. What about the idea of stretching directly into a muscle with pressure? So that's what we're going to do. So let's start applying some pressure to your quadriceps. So I would say, first thing you want to get down on the floor, and you can do this with your thumbs, you can do this with the ball. I'm going to do it with my thumbs because that's what I do on a daily basis. And you just want to find areas of the muscle that feel hard and apply direct pressure right into those areas. So if the muscle feels hard, that's an indication that it's tight. The muscle should always be very soft, very pliable. The only time a muscle is hard is when you flex it. So if it feels hard around the area of pain, that's an area where you need to be applying pressure.
Oh boy. Feels hard right here for me.
Right, so that's where you need to be applying pressure. So you can do it with a lacrosse ball, you can do it with your thumbs. And remember that the knee pain can come in any location. It can be on the inside of the knee, the outside of the knee, right on the top of the knee. So you have to figure out where those muscles are tight. Generally on the inside of the knee, it's going to be the muscles of the quadricep that are on the inside. If the knee pain is on the outside, it'll be the muscles on the outside. So you have to figure out where your knee pain is and then push into the muscles that attach right at that spot.
Okay, so I found the tightness. I feel like my thumbs aren't strong enough to dig in. How would I go about doing this with the lacrosse ball? Just flip over and go to town?
That's what I would do. I would flip over because you have to have a decent amount of pressure to be able to stretch it. And if your thumbs aren't strong enough to actually penetrate that tightness, then you're going to need a little bit more power behind it. So let's have you flip over.
And go to town, as they say.
Go to town, all right.
I feel like that was a dad phrase that I just stole from my
So how does that feel?
Oh, that's something. That's really getting in there.
So the key part with this is it's static pressure. So what I mean by that is the pressure is in one spot. You don't want to apply pressure and move around. So let's have you actually do that, but go very, very light. Just kind of move back and forth. Right, so this is what people are commonly doing. You don't want to do that. That's distributing the force away from the muscle. You have to keep that force directly into one spot and force it to stretch. Now, it's okay to move between spots.
Okay.
But what you want is to apply pressure in one spot, come out of it, move to the next spot, hold pressure. So hold pressure for 2-3 seconds between or at each spot, and then move between the spots. So any area that feels tight, any area that hurts, those are the areas that you need to be.
Do you want me to move in a grid?
I do. So that's a good point. So we call that a grid format. So basically there's no fiber that goes untouched. Every single muscle fiber of those particular muscle groups needs some type of pressure. So if you want to start at the lateral edge and just kind of move zigzag back and forth, left and right, that's fine. But you want to have an organized approach. You don't want disorganized therapy where you're just randomly pressing into muscle tissue and hoping for the best.
All right. Okay, so I'm going on my second pass here.
Okay. So that's good. So doing it at least 2 or 3 passes, really, really important, because what you'll notice the first pass is typically it's pretty sensitive.
Yeah.
Your neurological system at that point is on guard. That's what's actually causing the pain. But as you flush that tissue with fresh blood by applying pressure, it desensitizes your neurological system, so you can actually apply heavier pressure into the tissue, forcing a deeper stretch. And that's a very important part.
Ooh, 2 times through.
Good. All right, so that was more of the central part, right? So that's good. Let's have you go on your side. So this will be the lateral part, so the outside of the knee, right? So a lot of people will call this the IT band. It's really not the IT band, it's the muscle underneath the IT band. So let's have you go on your side. Find the tendon of the IT band and apply some pressure up and down this muscle here. But let's go a little bit closer to the knee this time.
Got it.
And it's the same idea. So you want to apply your body weight, try to find a comfortable position.
Ooh.
Yep.
This is something. Okay, same thing, grid?
Yeah, so grid it out. So you want to start at the very end of the muscle, apply pressure 2 or 3 seconds, move to the next spot, hold pressure for 2 or 3 seconds, and just keep doing that up and down the entire length of the muscle.
I'm trying not to massage. I'm lifting and moving. This is the part of the knee that I actually experience pain in too. This muscle gets tight for me, especially when I'm running and I find myself just like stopping and doing a figure 4 stretch and then coming back to the run. But then I have to just keep doing that every quarter mile once I experience pain. But that's because, Eric, stretching is not doing the job.
Yeah, those muscles that attach there, you can think of them as pulling at that attachment point. And they're pulling because they're tight. So the thought is to stretch them lengthwise, to stretch them out, but that just doesn't work. You're stretching around that tightness. That tightness is what's causing the pain. So to stretch it with pressure is actually a very effective way to break up that tightness. It just doesn't happen with a foam roller. It doesn't happen with massages. It doesn't happen with conventional stretching. All right, so let's try it with a different orientation. So the other orientation that you were doing was fine. It's a little bit more work to hold your body up. I would say that's a great orientation if you need a lot of pressure, a lot of body weight on that area. A lot of people are pretty tender through the outside of the leg, so I don't think that they will need that much pressure. So this is a much more comfortable position where you can spend time reading or watching TV or whatever you want to do while you're working on your muscles. So let's do the exact same line. Apply pressure there, and yeah, exactly. So just kind of leaning forward is an effective way to increase the pressure. And what you can do with this arm is you can actually move the ball.
Oh, that's great. So smart.
So instead of moving your body, you want to move the ball and keep your body in place. Because if you're moving your body a lot and you're holding your whole weight on your shoulder, you're going to last about 30 seconds. It's pretty exhausting.
I experienced that, yes. This is much easier.
So anytime that you guys are doing this, find a comfortable body position where you can move the lacrosse ball, or you can move the Knobble or the Theracane rather than moving your body, and a position where you can increase and decrease your body weight with ease, because then you'll be able to do it for 20 minutes, 30 minutes. If you're holding your body weight, you won't be able to do it very long. And the pressure won't be controlled. The pressure has to be controlled.
So I am feeling this for sure. I didn't think that I'd be applying enough pressure in this position, but this is actually a delightful amount of pressure.
Yeah.
It hurts so good.
It's more about accuracy and precision than the amount of pressure. Right? So really think about, get right in the center of that tightness and apply pressure in there. You won't need a lot of pressure if you're hitting that area accurately. If you feel like you're using a lot of pressure, you're probably slightly off the mark.
Ah, all right. I did that pass. That was much more enjoyable.
Right. So now we covered the top of the knee, we covered the outside of the knee. Let's cover a little bit on the inside of the knee. So I would say let's flip you over and let's do the inside of the knee with a similar position.
Okay. So if I'm going to do this inside of the knee, I'll just keep facing this way. How about that?
Yeah.
How should I?
So you can do it with thumbs. You can also position the ball. Sometimes I will use the foot.
Genius.
Yeah. Well, when you work on yourself.
Oh dear.
Yeah. How does that feel?
Right away. Oh man. This is incredible, but also, ow.
Yeah. So remember, it shouldn't hurt. Healthy muscles have no sensitivity when you push into them. So if you push into your muscles and they feel tight and they feel sensitive, that's a sign that they need some pressure. They need some therapy to make them healthy again.
So Eric, while I continue to move in a grid formation, you've been working on your own muscles and other people's muscles for decades.
Yes.
And you helped yourself stay healthy as a professional table tennis player.
Yeah, I mean, my father is the inventor of the therapy, so he taught me a lot of the mechanics about it. He was an engineer that just figured out some really interesting ideas about how muscles work. But when I lived in Europe and Asia as a professional athlete, I had to learn the therapy by working on myself. So I learned, clever ways like that just to apply pressure with a lacrosse ball or a golf ball. But it was amazing to me how I could self-treat and loosen up my muscles better than any of the specialists I was seeing in South Korea or China or Sweden. I would see specialists and they'd offer me exercises and stretching and things like that that really weren't that effective. I would get on the floor with a lacrosse ball or a Knobble and apply pressure to the muscles, and it was infinitely more effective. And I could train and I could do the things that I wanted to do.
So I just did a grid around that whole area, so moving about an inch or two.
Good.
All the way around, applying pressure for 2 or 3 seconds.
Great.
This feels great.
Great. All right, so now we've covered all aspects on this side of the knee. Now let's talk about posterior knee pain or pain on the back of the knee. So that could definitely be coming from the hamstrings. Your hamstrings all attached down here. So let's do the same thing. So just you'd be sitting down and be applying pressure on the hamstring, and you can get a little bit more on the inside of the knee, a little bit more on the outside of the knee. You don't want to be directly behind the knee. There are a lot of nerves and structures that are pretty sensitive directly behind it. So you want to stay more inside the muscle belly.
Okay. So would you go thumbs here or would you go lacrosse ball here?
Let's try lacrosse ball first. And I like what you're doing now. So you're actually doing what we call a pre-stretch. I know you love the pre-stretches.
I do love a pre-stretch.
So let's talk about what's actually happening. You're stretching it 2 ways now. So whenever you lean forward, you're stretching the ends apart, which is great for all of the pliable tissue. But what it's doing is as it's pulling the ends apart, the deep tightness is being brought to the surface so that you can actually stretch it with pressure. So you're stretching in 2 planes now. You're stretching away and into the muscle with pressure. So this is a really effective way to break up tightness.
And I just found it so intuitively.
Yeah.
So you'll notice my leg that is not being worked on is bent. My foot is being used to hold the lacrosse ball, and I am moving the lacrosse ball myself with my hand.
It's really an intuitive approach. It's funny how often patients come in and they're doing all of these different treatments. They're not getting much better. And they'll tell me, when I grab a lacrosse ball and I dig it into my hamstring or I dig it into my back, that instantly gives me relief. What are you doing when you put a lacrosse ball into your back? You're applying pressure. So to me, it makes perfect sense. That's the only thing giving you relief. It's the only thing that's forcing the tight tissue to stretch. It can lack precision, so it takes a little bit of practice to make sure you're pushing into the right spot. So if the pain is persisting, definitely come in and see us so we can do an evaluation. If pain is inside of the joint, or it's very, very sharp, or the pain seems out of proportion to the touch, if you're barely touching it and the pain is excruciating, definitely go get an image to make sure that something more serious isn't happening.
And he feels great.
That's great. You should feel a warm sensation. Lighter is one of the more common words I hear. Makes a lot of sense to me. When your muscles are pliable, they will feel lighter, more mobile.
Thank you for helping me with my knees today.
You are welcome.